Good morning, and thank you all for coming. We are here today to update you on the hepatitis A outbreak, set expectations for what happens next, and let San Diegans know what they can do to protect themselves. There are lives at stake. Every person affected has a family, has friends. This is personal. This is our community, and we will protect it. And I want San Diegans to know that the county has their top medical professionals working on this, many of whom who you see standing here behind me today. Medical, county, and city officials are in constant communications with each other. There's a plan of action, and we continue to work together to battle this outbreak. It's been in effect for several months. We are not going to stop until it's gone. And it's very simple: vaccination, sanitation, and education. And now I'd like to introduce County Supervisor Ron Roberts to talk a little bit about what the county is doing to address this, some of the resources that are available to all San Diegans, and of course, we are going to hear from our medical professionals. Supervisor Roberts.
Good morning. Thank you, Mayor Faulconer, and thank you, all of you, for being here this morning. I just want to first note the partnership that's at work here today between the City of San Diego and the County of San Diego, and I'm very appreciative of these efforts. This really is a commitment on the part of both of these government agencies to do everything possible to stem this epidemic that has settled on San Diego County. This is unprecedented. This is a health incident that is unprecedented in the type of thing that's occurring and how it's come about. The first signal that anything was wrong occurred late, maybe in February or March, where we saw some unusual strain of hepatitis A, and we've been ramping up our efforts ever since then and to deal with this. We've received counsel from the experts at the Center for Disease Control and the California Department of Public Health. We're getting good support from other agencies, both national and statewide. We have made every effort to step up our responsible efforts to deal with this. We are sending public health nurses into areas where we have police protection to make sure that they are going to be safe and trying to reach certain individuals who are largely part of our homeless community. And we're going and making every effort to go where they are, as well as to reach them. These are challenging efforts. Not everybody you talk to, even after you explain to them the dangers, is willing to be vaccinated. And vaccinations and hygienes is the strongest and best thing that we can do. But it takes a while sometimes to convince people that this is something that's in their interest and they should do something about it. These are largely people that aren't going to see the news reports or the press reports or be aware that there is something even bigger going on here in San Diego County. But we have to reach them, and we will. Our team has mobilized our community partners, other nonprofit organizations and other agencies, with calls, with emails, with letters, with teleconferences, and with meetings. There's a strong outreach program that's taken place. Even the Regional Task Force on the Homeless, which I chair, has stepped up its involvement. And in fact, we were able to connect with the Department of Housing and Urban Development and have obtained their assistance for this region. Their role is to advise and to help us to convene the homeless services and the providers that we need to counteract this health emergency. The county team has earned my deepest appreciation. We have people who are working around the clock and have been on this. More needs to be done, and we're ready to do that. Vaccinations are the tool that are, without a doubt, the most effective. We have now done over 22,000 vaccinations. Of the 22,000, 15,000 of those have been in the high risk category. These are homeless people. These are people, drug users, both intravenous and non-intravenous. We've also dispensed 1,400 hygiene kits, largely around the county, but in the downtown area. And we're in our third round now of hiring and training temporary public health nurses from other companies that are making these available to us. So working in cooperation with our largest homeless providers, these nurses are playing a huge role in fighting this disease. And we'll continue to get our homeless and at-risk populations vaccinated, both in the city and in other hotspots. And when I say that, we're not recommending that everybody go out and get a vaccination. We're trying to focus on the highest risk, and we've worked with the groups to help people to understand who those are. But we're going to work to get to work with our public safety people, work with anybody that is connecting with the homeless, providing services or doing cleanup or having any connection. We're working with the restaurant industry and other food handling operators to make sure that they are calling the attention of their workers to be vaccinated, and we're making vaccinations available to them. I want to thank the media for its responsible coverage of this health emergency. I want to make it also clear, this is not a foodborne illness. This is not a foodborne illness. This is something that goes hands to mouth, and it's transmitted in that fashion. We probably need to remind people to do the fist bump instead of the shaking hands. That helps, but also helps fight off the flu, which we're going to be getting into that. So this is, we want people to be informed. We want them to know what to do. We want them to practice good hygiene. And we've put out on the streets now for people who otherwise don't have access, places where they can wash their hands thoroughly. So anybody that wants a vaccination, those are available. You can call 211 and they can give you a list of sites. You can find something convenient. If you want to, we're not necessarily recommend that everybody be vaccinated. And most of you might be surprised, but since 2006, all of your children have been vaccinated as a health requirement for being in school. So we will keep you informed. We will give you the latest information. And I'd like to have our medical experts, one of whom is Nick Hepatitis, who's our Chief Medical Officer for the county, and he has some information to share with you.
Good mid-morning. Thank you all for being here, and thank you Supervisor Roberts, and thank you Mayor Faulconer for your advocacy and your leadership on this issue. I'd like to also quickly acknowledge my medical colleagues standing behind me, in particular our Public Health Officer, Dr. Wilma Wooten, who is here with me today, as well as leaders from our local medical society. You'll be hearing from one of them momentarily, and other colleagues and medical colleagues and partners from our community as well. Thank you all very much for being here. The hepatitis A virus is highly contagious, and it is transmitted person to person by the fecal-oral route. Most commonly, transmission occurs among close contacts of people who are infected with the virus. Although hepatitis A can also be transmitted with contaminated food, common source food exposures are fortunately now rare in the United States. Let us be clear, this outbreak is not from a contaminated food source. It is caused by person-to-person transmission. One of the challenges with this virus is the long incubation period. Incubation period refers to the period of time from which somebody gets infected to the point where they display their symptoms. With this virus, the average incubation period is 28 days, but the range of the incubation period can be anywhere from 15 to 50 days, which is quite a long incubation period. Another complicating factor, medically speaking, is that individuals can be infected and can be transmitting the virus for up to 2 weeks prior to them having any symptoms. For those in whom symptoms develop, the symptoms of hepatitis include fever, fatigue, nausea, vomiting, abdominal pain, loss of appetite, a darkening of the urine, and something called jaundice, which is a yellowing of the skin and the white of the eyes. It is very important for us to highlight today the fact that while this is a broad concern, there is a targeted subgroup, a very focused subgroup in our community that is at high risk for which we have the greatest concern. And those high-risk individuals, some of whom have already been mentioned, include the homeless, IV and illicit drug users, men who have sex with men, individuals having sexual contact with someone who has the hepatitis A infection, people with chronic liver disease, and individuals who have clotting factor disorders. These are all individuals that we stress must absolutely receive the hepatitis A vaccine. Based on our current circumstances, and based on the unique and unprecedented situation that we are in San Diego currently, our public health department, under the leadership of Dr. Wooten, has expanded the base of who we are recommending receive vaccination to include the following occupational groups. Excuse me. Fire, emergency, and law enforcement personnel, food handlers, healthcare personnel and professionals, service workers working directly with the homeless population, and individuals working directly in substance abuse treatment programs. And finally, public transit workers. We have to acknowledge that based on the nature of this outbreak and based on insights that we have gleaned from history prior to the availability of the vaccine in the late 90s, we actually expect that this outbreak will last longer, and this outbreak will likely have an additional number of further cases. Frankly, this outbreak could last for at least another 6 months, and unfortunately, there are going to be more lives that are going to be at risk. I'd like to now provide a summary snapshot of where we are in terms of the outbreak as of the availability of the most recent data that we have compiled, and that is as of September 14th. We currently have 444 confirmed cases with an additional 44 cases that are suspicious and pending confirmation. Of those, we have had 305 hospitalizations. We have had 16 deaths, with 2 additional deaths that are pending confirmation and are under investigation. The age range of individuals affected by this outbreak is wide, from a young of 5 to 87 years of age, with the majority of the cases occurring in the 24 to 44 and the 45 to 64 year age range. Of the 444 cases, the following is a general breakdown. 34% of them have occurred in individuals who are both homeless and IV or illicit drug users. 17% of them have occurred in individuals who are homeless only. 13% of them have occurred in individuals who are illicit or IV drug users only. And 24% are neither homeless nor illicit drug users, but we have found that many of these cases have some relationship with individuals who are in an at-risk population. The remaining 12%, unfortunately, for a variety of reasons, there are no available records for us to be able to classify them accordingly. Of the 16 deaths that have occurred, we have history available on only 15 of them. All 15 deaths that have occurred that we have a known history for have occurred in individuals who had complicating underlying medical conditions and who were at a compromised baseline of health. All but one of those individuals was either homeless and or a IV illicit drug user. In terms of the vaccination update as part of our response, as of the most recent day that we have compiled all of our information from September 11th, last week, in collaboration with our community partners in the healthcare community, with homeless service providers, and with behavioral health partners, we have now vaccinated 22,966 people in San Diego County. Of those, 10,332 of the vaccinations were given directly by county staff to the at-risk population through a variety of innovative means. Field events, to include foot teams going out into high-risk remote places, mobile vans, mass vaccination clinics, the jails, detention centers, tuberculosis clinics, and our county psychiatric hospital. Of the remaining 12,436 vaccines that have been given to date, the rest were given by our community partners in collaboration, including our healthcare systems, our federally qualified health centers, community clinic network, and our local pharmacies. And then just as a footnote, of the remaining few, there were 198 vaccinations that were given to individuals who were known to have exposure to the virus as a form of post-exposure prophylaxis. Our goal and our highest priority is to vaccinate the entire at-risk population. We want everybody who is in a high-risk group and those who are in association with them intimately, and the additional occupational categories that I mentioned, to get vaccinated. Finally, I want to provide reassurance that hepatitis A infection is not deadly in the vast majority of otherwise healthy adults. Most healthy people actually completely recover from the hepatitis A infection. We are not recommending, as Supervisor Roberts pointed out, and I am reaffirming, that all adults get vaccinated for hepatitis A. Our priority, again, is the at-risk group, those in close proximity to them, and the occupational groups that I previously mentioned. I will say, as a provider and as a physician with the rest of my compassionate colleagues behind me, if, however, there are individuals who have a felt need that they may have had exposure to the virus and who want to have the vaccine, it is perfectly reasonable for you to make that request of your medical provider. Quickly on my behalf, in addition to vaccination, there's the issue, of course, of sanitation as well. Washing our hands with soap and warm water is so important. Hand sanitizer, for as convenient as it might be sometimes perhaps, is actually not as effective as good old soap and warm water washing, hopefully for at least 20 seconds. Hepatitis A infection can be prevented, and we are passionate to make sure that we respond accordingly on behalf of our community. The last thing I would like to say is with regards to the availability of the hepatitis A vaccine. If you are a member of the general population and you have concerns in light of everything that we have talked about, you certainly have the right to pursue getting the vaccine from your own medical provider. In the upcoming weeks, and more details have been shared with that, and more of that availability of information is forthcoming, we will also be doing some special vaccination clinics open to everybody. And lastly, we are very fortunate in our community to have access to the resource of 211. If people don't know where to go, all they need to do is call 211 or go online at 211sandiego.org to get an appropriate location. Mayor Faulconer, the podium is yours.
Thank you, Dr. Nick. Next up, thank you, Dr. Nick. Next up, I want to make sure that I introduce Dr. Seng, who was going to say a few remarks. Dr. Seng.
Hello and good morning. I'm here today in collaboration with our city and county's top officials to remind everyone of one very important message. Wash your hands. Remember what our mothers used to tell us when we were younger. Wash your hands. Remember what our teachers used to tell us. Wash your hands. And they were right. And they are right. And you know what I'm going to tell you today on behalf of over 6,000 physicians across entire San Diego County? Wash your hands. Say it 100 times in 100 different ways. Say it in Spanish. Say it in Chinese. Shiso. Right? Lava las manos. I'm here today to tell you that this very simple message is very important because we're dealing with a bug that can live in the environment for over a month. We listen to our mothers. We listen to our teachers and doctors for a couple days. And then we go back to our old bad habits. I see the same thing in my patients sometimes, and I see it in my kids. So we know. The prescription is simple. Wash your hands. You know, fortunately, as Dr. Hepatitis said, that we're stronger than the Hep A virus. Over 96% of those infected will survive. But in order to break this cycle of transmission, we must not only vaccinate, we must be washing our hands. Okay. So please, get vaccinated, get educated, be aware, and wash with care. Let's work together to break this cycle of the hepatitis A virus. Thank you.
Thank you, Dr. Seng. Thank you. Thank you. Conclusion will be available for questions. Both the doctors, of course, address vaccination, education, and sanitation. I want to talk a little bit more about sanitation. As you know, 3 weeks ago, the county installed 41 wash stations, mostly within the city of San Diego. And last Monday, the city began sanitizing hotspots 3 times a week in the downtown area. Crews will be sanitizing sidewalks and streets again this week. And next week, we'll be moving to other locations as well. On Wednesday, we moved forward with 3 locations for temporary shelters for the homeless, one of the populations that is most affected by hepatitis A. And also last week, we opened 14 restrooms in Balboa Park that are 24/7 now. And on Saturday, opened 4 more restrooms at the Civic Center in downtown. This week, we have several new actions. First, more restrooms are being set up at 1330 G Street downtown, and they will be open by the close of business today. There are free vaccinations being administered at the Central Library today and tomorrow. Those are free. That's Tuesday and Wednesday from 2 to 5 on both days. And beginning this Thursday, outside Golden Hall downtown, we are going to be offering free vaccinations from 7 a.m. to 4 p.m. So thank you. This is an agreement with American Medical Response, the Downtown San Diego Partnership, who have been great partners on this. I want to thank particularly AMR, Mike Murphy, and the Downtown Partnership. Thank you, Chris Michelle, for your action on this. This is what San Diego does. We work together, and we step up in times of emergency, and we work together. So we want to strongly encourage, as you've heard today, anyone who is a part of the high-risk groups to take advantage of these free vaccination locations. This is our community. We're all in this together. And we are going to take care of our community together. Everyone in San Diego County has a role to play. And we're going to need the media's help and to get the word out. It's going to require a sustained effort and a sustained commitment. And we will get through this. We are a safe community. We are a healthy community. And it will remain that way as long as we follow the advice of our medical professionals. Vaccination, sanitation, and education. That's the key. Again, thank you to all of our county partners. Thank you to everybody who's been so strongly involved in all of this as a regional effort. That's what it's going to take. That's what's going to take the collaboration. And the fact that everybody feels so strongly about working together is going to make all the difference in the world. Thank you. I will pause. Any of the doctors, any of us will be available for any question. Did you have a question for Dr. Nick?
I have a question. If you want to work downtown, do you recommend getting vaccinated? And how about pregnant women or women trying to get pregnant? Do they get vaccinated?
Thank you. With regard to individuals who just live downtown and work downtown, we are not recommending universal vaccination unless the work downtown involves one of the special subgroups that I mentioned during my comments. Just by having a job downtown is not an indication currently for vaccine, but in qualifying that, I would ask that we remember that if folks have a felt need and they feel like they have been exposed to the virus, they have the right to request the vaccine of their medical provider. With regard to pregnant women, Dr. McDonald, would you be willing to come down and answer that question, please?
Sure. Yes. With respect to pregnant women in of themselves are not at risk, so it's not a routine recommendation unless they're in one of those categories we just talked about. But the vaccine is 100% safe in pregnant women, if that's the kind of the gist of your question. It's very safe and effective.
Thank you.
Other questions?
Dr. Nick, is there a reason why you're not advocating universal vaccinations, if you will?
Yes, thank you, Ed. Good to see you. It is not necessary. And we want to prioritize the availability of vaccine to the high-risk groups, their associates, and those occupational categories that I mentioned. There is, with appropriate sanitation, no reason for the general, otherwise healthy population to have over concern about this. In terms of the logistics, there is absolutely no vaccine shortage, but we want to prioritize the available supply of vaccine for those who absolutely need it the most. And as we collectively, as reflected by the number of cameras today, elevate this issue and educate our population, we want to make sure that the priority vaccines are made available to those individuals.
May I follow up?
Anything.
Do you feel with the kinds of actions that have been taking place within the last week and a half, do you see any sort of stability with the outbreak? You did predict that there will be more cases. Do you see a trend here that we have some stability?
Yeah, welcome to microbiology class. Because of the long incubation period that I mentioned, of 15 up to 50 days, it will take at the minimum a couple months for us to be able to see that progress. Because of the nature of the virus and its robustness of surviving in our community, even if everything was optimized based on the nature of our outbreak, there is an environmental presence, so this will require some time, despite all of our efforts, to work its way through. And again, in some regards, we are in a very unique and unprecedented, uncharted water with regard to what is happening, because since the mid-90s, when the vaccine became available, and in the late 90s in California, in the mid-2000s universally for the rest of the country, Hepatitis A vaccine prior to that wasn't available. Outbreaks like this typically ran for about 12 to 18 months based on our epidemiological modeling of where we've come from and how long we've been dealing with this. That is where I came up with the projection, if you would, that we might be looking at another 6 months of this outbreak.
Dr. Nick, there's been information talking about one particular strain having a connection to Santa Cruz. We've also heard about LA County doing things to try and prevent this. At this point, is there a possibility that this could migrate to another county? Is that inevitable, or are there ways to prevent that?
Dr. McDonald, as you make your way back down to the microphone to help me with that, I will tell you it has already migrated to other parts that we believe have originated from here in San Diego. But Dr. McDonald, please.
Yes, very, very quickly, there are other locations that have had cases that are linked to us by the viral sequence testing that has been done by the Centers of Disease Control. Santa Cruz County is one of those locations. But what other communities are already doing is learning our lessons and actually vaccinating homeless individuals in their community. That's what's happening in Orange and Los Angeles counties. And really, the CDC is likely to add homelessness as an indication for vaccination moving forward. But there is the possibility, because of just the travel, that cases can be found in other locations.
How high is that possibility?
Well, again, it's a close person-to-person contact issue. So if someone who's infected goes to another location and has close person-to-person contact with others, and they don't know it, then it is always possible, but very low.
No, go ahead. It's your call.
Thank you. One quick follow-up, just considering the time of year that we are in, I would be remiss if I did not put things in a little bit of context here. First of all, I mentioned we have had 16 deaths so far, all of them unfortunate, with 2 more currently under investigation. With the upcoming flu season, our annual experience has been between 80, 90 or so deaths each flu season year. There is somewhat of a parallel when you hear us talking about this from the prioritization of influenza vaccination. And we are going to work through this as a community, but in the coming weeks, imminently, we will be actively promoting the influenza vaccine as well, and wanted to put the experience that we've had with hepatitis in context accordingly. I saw some other hands raised.
Yeah, I've researched recently. It seems like the county knew about this outbreak for months, and in the last few weeks it really stepped up their efforts. Can you talk about a turning point, or was there one, or why did it happen sooner?
The question is with regard to, has there been a turning point recently? In actuality, if you were to look at what we call the epi curve, we first noticed a blip on the screen, if you would, in March. In terms of the baseline number of cases that we have, most of them, by the way, historically in San Diego County over the last couple decades, occurring in individuals who are returning to San Diego having traveled abroad. In March, when we saw that blip, through the wonders of our epidemiological investigative team, we were able to do some backtracing, and in all likelihood, this outbreak probably originated in November of last year, in 2016. There has not been a medical recent issue that has brought this to the forefront. I think instead is the realization and the collective unity of us coming to terms with the fact that this is unprecedented, and for us to really get the upper hand on this outbreak, it's going to take this kind of collective effort, collaborative spirit, unity of coordination, hence our passion and commitment to respond accordingly.
Dr. Nick, you guys are out here today spreading awareness, all these cameras out here. As Supervisor Roberts pointed out, a lot of these people don't get news like me or like we do. And as he said, a lot of them, they don't necessarily want this vaccine. So when you guys contact these people, what are they saying? And do they understand the scope of the outbreak and how easily it's spread?
Thank you very much. The question has to do how nice it is that we are doing what we are doing here today, but potentially some of the high-risk individuals who are at stake with regard to this outbreak aren't going to be watching our evening broadcast. That is part of the challenging, transparent reality that we are facing with regard to this current situation. Because of the nature of the population, many of whom are homeless, many of whom are IV and illicit drug users, there are times where we face the challenge of their reluctance, suspicions, concerns about the government coming after them, if you would, with a needle. And so that is why we collectively are looking at this as a hybrid response to include, of course, the vaccination. The educational piece is so important. We have had to spend a tremendous of extra time, talents, treasures, and tenacity for us to be able to do outreach with some very, sometimes inaccessible, and sometimes suspicious and reluctant individuals to convince them of the need to get vaccinated. And so when I talk about some of the unique features and the distinctive nature of this outbreak, that good question takes that into consideration.
And then a second question, have you guys identified the source of the outbreak yet?
We have not identified a source of the outbreak. Back in March, when we did our retrospective analysis and were able to trace back to what we suspected was our first case last in November, that individual has been lost to follow-up. And I want to emphasize, again, repetition, right? This is not a foodborne outbreak. It is now in a community of high-risk individuals. And so while there is concern and issues to address food handlers and those kinds of issues, this is not a foodborne issue primarily, and we do not have an original source that we have identified.
We're going to do one more question and then break for one-on-one.
Okay. Sir, I guess with the glasses, you get the last question.
I wonder, this outbreak started in March. We're here today in September. Why not just show a force a couple months ago?
We, at the county and in collaboration with the city, have been working collaboratively. As I mentioned already, I think we now have an opportunity to work even closer together, and because education is such a high priority with regard to getting this message out, our passion and our desire of putting up and being responsive and proactive and transparent with regard to our communication with you is what you see before you today. We have been doing, Dr. Wooten, Dr. McDonald, and other members of the county team have done many, many interviews. We've been at this for months. I think what you're seeing is a higher level of collaborative effort and unity in responding to this situation.
Very good. Thank you, guys. Thank you, Dr. Knight. Thank you, guys.